The Africa Centers for Disease Control and Prevention is currently holding a media briefing on COVID-19 responses from the continent. Let's take you there live.
Have experienced a more severe third wave. Since the last briefing, no additional countries have experienced a third wave. 47 countries in Africa, which makes up 86% of our countries, have experienced a fourth wave. And 31 of those, which is 66%, have experienced a more severe fourth wave. Since the last briefing, no additional member states has experienced a fourth wave. However, 14 countries have experienced a fifth wave, and 7 of those 14, which is 50%, have experienced a more severe fifth wave. And since the last briefing, one additional country, that is Namibia, is actually experiencing a fifth wave. One member state, Mauritius, has experienced a sixth wave. Now, when we look at the situation of variants of concern, 49 countries have now reported the Alpha variant, and there is no additional country that is reporting this variant from our last briefing. Similarly, 45 countries have reported the Beta variant, and no additional country has reported this variant since the last briefing. 50 countries are reporting the Delta variant, and no additional country has reported Delta variants compared to the last time we did this briefing. 3 of our countries are reporting the Gamma variant, and since the last briefing, no additional country has reported this particular variant. 48 of our member states are now reporting the Omicron variant, and there is no additional country that has reported this variant since our last briefing. When we look at the period from November last year to date, 16 of our member states have reported the Omicron BA2 sublineage. When we look at the trends over the last 1 week, we are looking at week 20, which is 16th to 22nd of May 2022. And when we compare that week 20 with week 19, we are seeing a total of 46,684 new cases were reported in Africa, and this is a 21% decrease from the previous week. The highest proportion of the new cases are largely from Southern Africa, making up 95%, while the other regions, Northern Africa 2%, Eastern, Western, and Central Africa regions, each having 1% of the new cases reported during epidemiological week 20. Of the new cases reported during this Epi week, the following 5 countries are reporting the highest numbers of new cases. And that is South Africa with over 38,000, Namibia with just under 2,000, Zimbabwe with 1,400, Morocco with just over 800, and Tunisia with 673 cases. The following 5 countries are reporting the highest daily incidence per million population: Botswana at 2,504, Namibia at 105, South Africa at 89, Eswatini at 54, and Cabo Verde at 14. In terms of deaths, a total of 278 new deaths were reported in Africa compared to 308 from the previous week. And this represents a 10% decrease in the number of new deaths compared to the previous week. Now, let's look at the epidemiological trends over the past 4 weeks. New cases, there has been an overall 36% average increase when we compare the last 4 weeks to the previous 4 weeks. And the following regions have reported during this new 4-week period as follows: 40% increase in Southern Africa, 40% increase in Central Africa, 23% increase in Eastern Africa, 17% increase in Northern Africa, 14% increase in Western Africa regions. In terms of the most populous countries, the following is the breakdown. Nigeria, 34% increase. Ethiopia, 33% increase. The DRC, 33% increase. Kenya, 26% increase. South Africa, 19% increase. And Egypt, 69% decrease. In terms of deaths over the last 4 weeks, there has been an overall increase of 26% in new deaths being reported in Africa. Breakdown by the most populous countries is as follows. South Africa saw a 32% average increase in the number of new deaths. Egypt, 53% decrease, while DRC, Ethiopia, Kenya, and Nigeria reported no change in the number of deaths during that 4-week period. In terms of testing and medical supplies, to date, over 108 million tests have been done for COVID-19 across all Africa Union member states since the beginning of the pandemic. 1.5 million new tests were reported for the AP week 20, that is 16 to 22 May 2022. This reflects a 212% increase from the previous week when only 513,000 tests were reported. Cumulatively, the positivity rate is 11% and the test per case ratio is 9.2%. During AP week 20, the positivity rate is 3% and the test per case ratio is 35, which is a decrease in the positivity rate and an increase in the test per case ratio compared to the previous weeks, respectively. 5% of our member states, and that is 3 countries, Eswatini, Namibia, and South Africa, are reporting a test positivity rate that is higher by 12% during this week compared to last week. Let me give you the COVID-19 vaccines update now. As of the 25th May, our Africa Union member states are reporting as follows. The total vaccine doses supplied to Africa so far is 812.4 million doses. And these have been donated or procured by 54 of our member states. The total vaccine doses that have been administered across all the 54 countries is 572 million, which corresponds to 70.4% of the total supply that has come into Africa. Overall coverage of the population that are fully vaccinated is 16.9% as of the close of business yesterday. The following 10 member states have vaccinated more than 35% of their total population. Seychelles at 80.6, Mauritius 76.5, Rwanda 62.6, Morocco 61.7, Botswana 61.2, Cape Verde 55.2, Tunisia 52.7, Mozambique 42.7, Sao Tome and Principe 40.0, and Lesotho 37.6. We update these numbers very regularly, and you can find the updated ones on our website. Eritrea still remains the only African Union member state that has yet to provide information on COVID-19 vaccine rollout. Let me also add an update on monkeypox. This has become quite topical now. Although we are seeing over, I think, 24 countries now reporting cases of monkeypox globally. In Africa, we have documented from 4 of our member states, and these 4 countries actually have endemic monkeypox. And so it is an illness that we continue to deal with as the outbreaks come and we control them. And the 4 member states are Cameroon, Central African Republic, the DRC, and Nigeria. 2 other countries are investigating suspected cases, and that is Morocco and Sudan. So when we look at 2022, the cumulative number of cases of monkeypox on the continent is as follows: 1,405 cases, 62 deaths, which gives a case fatality rate of 4.4%. And again, as I said, these are found in those 4 countries that I have given. As Africa CDC, we have provided guidance to our member states on increasing surveillance for monkeypox, establishing laboratory diagnostic capacity so that it can be easily lab diagnosed, expanding the knowledge of monkeypox amongst the clinical teams, and of course putting in place infection control, prevention and control measures as they engage with the communities that are at risk. For members of the public, we urge anybody who has symptoms to quickly seek medical attention. Indeed, the washing of hands is very important because this is a contact spread disease. So washing of hands, keeping your sanitizer in use, avoiding touching animals that look sick, indeed avoiding being in touch with animals that are known to be carriers of the monkeypox virus is highly encouraged for members of the public. And if anybody is found to have such symptoms, and quick medical attention is advised. As Africa CDC, we have established structures within our emergency operation centers on food alert mode to closely monitor the situation, not just globally, but particularly here on the continent. If at all we'll see a change in numbers or indeed change in countries where this is occurring. We are in very close touch with our counterparts in European CDC and the US CDC. Indeed, all other countries outside of those 2 areas that have reported suspected or confirmed cases. And we continue to engage and coordinate with our member states to ensure that information is flowing well across the continent and beyond. As I'm here at the World Health Assembly in Geneva, there's a lot of discussion going on around pandemic preparedness, looking into the future. And one key theme that keeps on recurring, apart from the many accolades that Africa CDC is receiving, is the need to strengthen regional preparedness and response plans and activities. And we are very happy to see that, because this has been one of the key messages that Africa CDC we are giving to the world. At the same time, we have the annual meeting of the World Economic Forum in Davos We participated the whole day yesterday, different session, where the key topic being discussed is manufacturing on the continent and which are the best options to ensure that Africa gets its local manufacturing, not just of vaccines, but all other health products that we use in health emergency, preparedness, and response. And finally, this is again the week that the Africa Union has called an extraordinary summit on humanitarian affairs and illegal change of governments across the continent, and that is being held in Malabo in Equatorial Guinea. And there we have two side events as well, with our partners looking at the role of the community health workers in universal coverage and health security, and also another one on finding innovative solution to humanitarian health crisis across Africa. So it's a full week for Africa CDC, and we are glad that you also have made time to be able to join us to discuss the health security situation on the continent. Back to you, Wayne.
Thank you very much, Ahmed. That was Dr. Ahmed Ogwell, the Acting Director of the Africa CDC. All right, let's dive straight into your questions. And the first three that we have are all on the monkeypox virus. So let's start by saying hello to Laura Lopez Gonzalez. And Laura is an independent journalist. She says, how many African countries in which monkeypox is endemic have access to smallpox vaccines? So that's the question from Laura.
No, thank you, Laura. Endemic currently is 4, the 4 that I've given earlier, and all countries have access to smallpox vaccines, not in the rate and the quantities that we would want, but they do have small stockpiles to be able to give at least to the health workers in the affected areas. We are working with these countries to see how to expand availability of more vaccines as may be required.
Well, thank you. It's hello now to James Chege-Macharia, who is with Reuters in Johannesburg. He says, I have 2 questions on monkeypox. The first one is, are there any African countries that are stepping up the testing and surveillance of monkeypox? And then the second question, what is the view of the Africa CDC regarding the use of vaccines for the containment of monkeypox? If vaccines are needed, is there any concern of possible vaccine hoarding by European countries? And I think James is referring there to what happened at the beginning of the COVID-19 pandemic.
All right, giving his first weekly presentation, Dr. Ahmed Ogwell Ouma, Acting Director for Africa CDC, following the departure of Dr. John Nkengasong, says South Africa is still way ahead of other African countries in terms of infections, coming in at 38,000 in the past week. He also says Eritrea is still not submitting COVID data to the center, and also touches on countries like the DRC that have experienced monkeypox, of course, that being the topical conversation.